get started then. I'm kind of loud too, so I really don't need the mic. We are starting the presentations here. First of all, thank you everybody for coming to the South Dakota Holistic Health Fair. Our first presenter here is Lori Steinley. If you're not familiar with Lori, first of all, she comes to us from Root Function Wellness, located here in Watertown. She is a PAC, a PT physician assistant. She's a physical therapist. She's a naturopath. And I'm going to take a breath now because she's got a lot going on here. She's certified in nutritional counseling. She has a master's degree in exercise psychology. And she has my heart because she is a certified reflexologist, which I think is amazing. So, Lori,
Thank you. Thank you. And I'm a naturopath. That didn't make the list, so that makes a difference.
Oh, it's in there. Okay.
Oh, it's in there. Yeah. Oh, it's in there. Okay. So, hello. I'm so glad all of you are here. And I'm serious though. If you can't hear me or see something, just raise your hand and we'll accommodate as needed. So I'm really glad to see all of you here. I'm very excited to talk about functional medicine this morning. And I work at Root Function Wellness. I'm one of the providers. Like she said, I'm a physician assistant, but usually when I see people come in, and have my time with them, I go through my whole list and they kind of look at me glazed and I'm like, and all that means is I want to treat all of you. So that's been my goal, is to find ways and avenues to treat the whole person. And that's what we're going to talk about today, because functional medicine definitely fits that mold. So I'm Lori, and again, if you have questions along the way, maybe hold those till the end. I think that, we'll talk probably for about 45 minutes and then we can answer those. Come on. Okay, so what is functional medicine? You may or may not have heard about this before. Oh, and just so, I've been a student for many years, so I can tell that some of you might want more information. So you can take notes, of course, but at the end, if you want to come up and put your email address down, I'll email you the PowerPoint. So I always like to know that up front, so I'm not frantically taking notes. So I will send this to you if you're interested, okay? All right, so here is a definition of functional medicine. Functional medicine model of care provides a unique operating system that works to reverse illness. And it promotes health, optimizes function by addressing what's at the root. That's why we're called Root Function Wellness. The underlying causes, symptoms, and functional imbalances in the whole biological network. It's beneficial and sustainable, associated with patient-related, health-related quality of life. We talk a lot about food, a lot about how you digest things, what you eat, lifestyle things, believing food is medicine to prevent, treat, and reverse chronic disease, and that nutrition and lifestyle really do need to be addressed. They actually should be the first line approach therapy when you're seeing a patient, but a lot of practitioners just feel very underqualified to talk to people about that. Despite that fact, it has been shown that nutrition and lifestyle are really the foundation of people getting better. So, the only reason this is a very busy slide is because I wanted to impress upon you, what does functional medicine treat? All of these things. And so I was trained as a primary care physician assistant. And so this falls right under a whole bunch of primary care type things. So the reason it's so small and has all these things in there is we don't say we're primary care, but we are a primary care more on the functional basis. I will say from the out front, because this happens a lot, people call us up, we don't do primary care because we don't treat sore throats or urinary tract infections or things like that. We concentrate more on all of these chronic conditions. So we can do, I don't know why that one isn't, sorry. Anyway, allergy conditions like asthma, dermatology, fatigue, gastrointestinal is huge, so we see all of those. The autoimmune conditions, we're going to talk about a few of those. Heart conditions that are more chronic pain, that's more of my wheelhouse too, because I've worked in a chronic pain clinic and being a physical therapist for over 33 years, I did work with a lot of chronic pain patients. Gynecology, I'm a women's health specialist, and so that's another one. Hormonal, we do a lot with thyroid, adrenal, hormones, mental illness, neurological conditions. I'm also a headache specialist, TMJ specialist, migraines, dementia, and then pediatric things. So again, what I'm trying to impress upon you is that we do a lot, and can do a lot, but what we do is we look at you and how all of your body systems work together and why a downfall in some of those might be causing those conditions. So how does it work? Functional medicine is a medical care approach that again looks at the root of the problem. We're looking at the dis-ease, so what is not working correctly in your body and why the symptoms are developing. We look deep into the complexity of the body and how everything is related. There is a better chance to reverse the problem and restore health. And what I enjoy so much is that it's a partnership with your patients, because I want to work really hard to have my patients feel better, but I don't want to have them dependent on me. I want the patient to be independent, and I want to empower them to do that with their lifestyle and some of the other education type things that we talk about. So it does demand understanding, participation from the patient, and also, which I love, is we allow ourselves time. We allow ourselves time with people. I will probably bring this up later too, but our initial visit with a patient is an hour and a half. And that's after you've done a really intensive intake form. And both Dr. Wagner is the physician at Root Functional Wellness who started Root Functional Wellness. And by the way, she's a certified functional medicine doctor through the Institute for Functional Medicine. But anyway, so she had this all set up, and I joined her about a little over a year ago. I did functional medicine in the Minneapolis area. But anyway, we have a very in-depth intake form that she and I, before we see our patients, go over. And we tell patients that it might take them like 90 minutes to go over, but it talks about their whole history. So even though we have that wonderful amount of time, an hour and a half, we already know a little bit about you when you come in, and so we don't have to have you repeat it. And I have been a patient many times with a chronic illness, and I've been in that chair where I'm like, I gotta repeat this again, and you don't have to do that because it's all in your intake form. So I kind of feel like we hit the ground running right at the beginning and say, okay, this is what I see about you, now you tell me your story. And it's not just even in the here and now, it's, were you a C-section baby? Were you a vaginal baby, birth baby? All of those things make a difference to make who you are. And by the way, I've worked in Western medicine, clinics too, and the average office visit there is 8 minutes. So, just to compare. So functional medicine really does instruct what might be blocking the natural health from rising to the surface. We do lots of education, and I love that. Lots of education about nutrition, lifestyle, and how the environment is influencing you, and how to help you get back to optimal wellness. Optimal will come up during this lecture because I'm sure you've all seen doctors, and I'm sure you've all gone in, and if you had your thyroid checked, they would say, wow, you're normal, your thyroid is normal. Well, the range for one of the thyroid markers is 2 to 46. And you might be having symptoms. Mine is optimal, and my range for that same thing is between 1 and 2. And so I strive to get optimal, not average. But if you don't have symptoms, I might not mess with it because that might not be what's driving the bus, right? We need to check other things. Maybe it's your gut, maybe it's your adrenals, those type of things. So I just want to give you a little reflection of how we think in functional medicine and how it's different. So again, it's not about a quick fix. It's what's best suited for you personally. So everything is tailored to what is going on with you. Dysfunctions may take years to show themselves, and it takes a good 3 to 6 months to make a difference. Bless you. Also. And then what Dr. Amy has taught me too is functional medicine is a type of medical care that's driving a new clinical research, which is super exciting. Because I'm sure there are some people that go, well, that's not working. But the Cleveland Clinic is a well-renowned clinic, and they're doing research to prove that functional medicine is helping people. So that's very exciting. So what do we do? Here's our tools. So I'm a big information gatherer. So I do a lot of listening. I like to hear how you explain things. And so, I read your intake form, And then I say, okay, this is what you told me you had going on. This is the car accident you had. This is the surgery you had. This is the other things you had. Now you tell me, why are you here? Because it doesn't matter what I think. It matters if you think you can get better and what you think is your primary problem. I learned years ago as a physical therapist that everybody's goals could be different. You know, so I always say, what do you want to have done? How can I help you with what you want to have done? Because that's different for a lot of people, much different. So we're big information gatherers, and related to this, we also, when you sign up for an initial visit with us, we have you sign a release of information, and we get all your medical charts as able, and we try to review all of those, you know, before you come in too, or at least have them. Because as it'll come up, I like to do some preliminary labs, but I don't need to do labs if they've been done elsewhere, right? And so we try to keep the costs down, and also because I want to see if there's a trend as well. Oops. So after the information gathering, we do an objective exam, and it's like a typical exam that you would have if you saw your primary, but we have some new little extra things that we do too that are more functionally medicine based. A lot of times, as a naturopath, I've learned how to look at your face and your tongue and your nails, and what that means. I mean, if there's certain ridging on your nails, it could mean that there's a protein deficiency. And also, if we look at the tongue and it's coated and it's yellow, that might mean you have a yeast involvement. And those are things that just add on to the extra objective exam that we do, which is, you know, reflexes and palpation and listening to your heart and lungs. But those things add up together because I'm always looking for a pattern. That's what's happening in functional medicine too, is what is your pattern? Where did it start? Well, how did it transpose into this? And where do we go from there? And how to break the cycle of symptoms. So along with that intake form, we talk about triggers, timeline, antecedents, and mediators. Trigger is what causes your symptoms. So I want to know what that is because that gives me a little reflection of maybe what is irritated and where we need to go from there. Timeline has to do with your personal timeline of your life. I'm sure all of you can appreciate that if you had a traumatic event or abuse or something happening, how that influences your body. And I want to know when that happened and how you reacted and if it's resolved, those type of things. Antecedents are things we really can't control. It's our family history of problems. It is, you know, other things that we have going on that really are not in our control. And then the mediators are kind of those little smoldering things that you have going on every day that you don't realize might be contributing to the issue you have. And so all of those things actually show up on the intake form that we have people fill out. Lab work. I like to do lab work. Dr. Amy does as well. The last place I worked, we did a lot more blood work, and I often ask people, you know, when was the last time you had your lipids checked? You know, when's the last time you had, you know, insulin checked? And I guess for me, even as a physical therapist, I remember, you know, patients would come in and go, oh, my MRI was negative. I'm like, good, that tells me something. Negative tells me something. But there are so many people that go, you know, nobody even checked that with me, you know what I mean? And I'm not saying that we go crazy. There's just some basic ones that I want to check, like maybe your hemoglobin A1C, or, you know, see if you're anemic and check what your hemoglobin is. Just all of these little pieces that can give me a picture of who you are. And just so you know, we are a cash-based business, but we get a really good discount with Quest. So we actually send our blood work into Quest, and then people get their blood drawn at the Northridge Clinic here, or I can send labs to your town, wherever you want to go, and then they send them back to me, and we have a really good discount. So even if I do like 14 labs, oftentimes it's under $150, which is a really nice bonus for us. Then during our conversation, after the exam, then before you leave that appointment, we have a lifestyle plan for you. And that is diet, sleep, stress, exercise, and other things. So we have a health coach on staff, and her name is Dawn. She is a nationally certified health coach. She's awesome. She's also a registered nurse, has lots of experience in OBGYN, and also surgery and other things. But it is great because Dr. Amy started this, which is a wonderful idea, is when you come in for that initial visit, Dawn's included. So in that price, you get 2 visits with Dawn. And I love this. Dawn said, I said, how should I describe what you do? And she goes, say that you give them the rungs on a ladder and I fill them in with more rungs. So whenever people are looking kind of lazy-eyed at me, like you're giving me a lot of information, I'm like, Dawn will help you. I said, when you meet with Dawn, she will talk to you more about your diet, she'll talk to you more about the sleep, about the stress, and she's got some great skills. She does Reiki, she does heart math, if you've heard of that. So it's a stress reliever, so it's so nice to have those extra tools. You know, obviously being a physical therapist, you know, I also think that there are lots of conditions that could use physical therapy. I do physical therapy at the clinic, but more in the specialties that I have, which are craniosacral therapy or women's health, or those type of things, because I do a lot of manual therapy and I don't want to do as much of that anymore. But I also believe in massage, chiropractic, and then counseling is important too. You know, I think a lot of times you just need to ask those questions, you know. I mean, if they write, you know, I've been suicidal, it's like, are you a harm to yourself or others, and have you resolved this? Do you need to go somewhere? I mean, it's an easy question, and just say, well, can I help you find somebody? Can you talk to somebody about it? I mean, we take all of that into account. And then there's specialists. We're not against sending people to specialists. We don't pretend that we know everything. I think what we need to do is kind of piece it together and see where they need to go. There's our tree. I like this tree because it's a little overwhelming when you look at it, but I love it because we talk that we're root function wellness, and the roots down here say, you probably can't see it, but sleep and relaxation, exercise, nutrition, relationships, trauma, okay, now I can't even, environmental, and I love that that's at the roots, because then as you go up, what we talked about, there's the antecedents, triggers, and mediators, but look what happens, only up here on the top, I guess I didn't get the pointer, up here at the top, all of these are your body systems, and those won't flourish if those are not healthy, right? So you've got to have a good root system, and we believe that, and I just smile because there is something that we do in our intake form. It's called the medical system quotient or questionnaire. And I look at that number and then look at the person and go, we like it to be at 20. And a lot of people are in the hundreds. They have a lot going on. But after we get the lifestyle going and they repeat that when they come back in a month, frequently it's half that. And it's amazing to me. I'm still amazed by it, and I do this, that they took ownership of it, they made some good improvements, and it can really, really make a difference. All right, so let's just briefly talk about what functional medicine works with. We're going to do specific conditions, preventative things, what vitamins I like to use, endocrine, and hormonal. So, endocrine, thyroid. This is a big one. A lot of people have thyroid issues, and I think a lot of people actually have undiagnosed Hashimoto's. And how we check Hashimoto's, which is an autoimmune thyroid condition, is we check the thyroglobulin and also the perioxidase hormone. Now, I have worked in a more natural family medicine in the Minneapolis area and orthopedics and other places. And I've talked to a lot of my coworkers and said, well, this person needs to see an endocrinologist. And they're like, yeah, they probably do need to see them. And I've talked to them and they said, but if you send them to this endocrinologist, they don't actually do anything about that until their other numbers look bad enough to treat. And then they would use medication. But for us in functional medicine, what I love is if I see that there's a thyroglobulin or perioxidase that's high, we can change that with lifestyle. We can change it with lifestyle and diet. And they're saying now that some of Hashimoto's is actually a gluten sensitivity. We can check those kind of things. And so in my mind, if we can take care of it now, then it doesn't get to that spot where it, causes the other numbers to look bad and makes your thyroid work harder. So again, it's preventative, right? But we know that you might be on that path. Hashimoto's is also very genetic. So if you have other people in your family that have thyroid conditions, that can be related. So, and again, just in comparison, I'm not critiquing, but just in comparison, a lot of clinics do a TSH, and that's the first one up there, the thyroid stimulating hormone. That's the hormone in your brain that tells your thyroid to make T4. I check T4 as well. And T4 actually converts into T3, and T3 is what your body uses. And so I check all 3 of those, and then I check the autoimmune markers. So I do a 5-panel, where a lot of times in the clinic, they base their treatment just on what happens here. There's a lot more happening, and so I want to know what's going on with that. Again, that's just how I've been trained doing functional medicine. So we already talked about the levels, that I have more of an optimal gauge that I go by. Symptoms of hypothyroidism have to do with your metabolism. People have trouble losing weight. Heat and cold, they're cold all the time. Gastrointestinal motility, they could be constipated, or some people with hyperthyroidism actually have more diarrhea. Moods, lots of inflammation. Again, the T4, T3 regulate these, and the TSH is the messenger. Treatment, so I'm just giving you a reflection of how we work differently in our clinic and doing functional medicine. We like to use natural thyroid support, specifically iodine, zinc, and selenium really nurture your thyroid. So a lot of times we will start with a supplement like that. There are more natural medications, they're called Armor or Natural Thyroid, and those are more natural, and they have T3 and T4 in them. And then of course we can do medications too. Cytomel is the T3, I'm sure you've heard of Synthroid, levothyroxine, that's T4. We're not opposed to medications, but a lot of people come to us because they don't want to do the medications, or the medications aren't helping. So I'm just saying that we have other avenues to work on too. All right, so there's Hashimoto's. We talked about it some already, the autoimmune condition. A triggering event like stress or hormone changes can bring on some of the symptoms. Gastrointestinal disturbance, detected with the thyroglobulin and the thyroid peroxidase. With my women's health background and also with being a PT, I saw so many women that as a PT, I was like, man, I wish I could check their thyroid. But I couldn't do that until I became a PA. So that was one of the things that encouraged me to want to treat the whole person, because a lot of people, or even orthopedic doctors were saying, if you have bilateral elbow pain, you gotta check your thyroid. And I'm like, well, I can't, I'm a PT. But now that I'm a PA, I can check that. So your body tells you if you listen. So, the thyroid antibodies are present. We talked about that. So improving lifestyle, and I've seen numbers go down in the hundreds just by changing the nutrients, just by exercising more, those type of things, getting rid of some stress. Improving the lifestyle with less sugar and processed food for sure. Getting better sleep, sleep is huge, and daily exercise helps that. Also, we can do the autoimmune paleo protocol if need be, but a lot of times those other things take over and are helpful. So I often tell people your thyroid and your adrenal are like a teeter-totter. So if your thyroid's up here, your adrenal might be in the tank. So which do you treat? I treat both. And so we want to get you even. And so a lot of people have underlying adrenal issues. Whenever I say this, people shake their head because usually you get this tire around the middle, weight gain that you can't get rid of. It has a lot to do with hormone changes, a lot to do with stress. The adrenal system, like it says, produces hormones that help with your energy, your blood pressure. There's a real easy test that people can do where you lie down and take the blood pressure, and then you stand up and take the blood pressure, and it shouldn't change more than 10 points on the systolic, the top one, or you're suspect that it's adrenal issue. I don't just go by that, but there's some things when people say, oh, I get lightheaded when I stand up. Those are the things that I check out. Sleep is often disturbed, appetite, lots of body functions. The adrenals help protect you from stress. So the adrenals are your fight guys, I'm gonna take care of this, but what happens when your stress never goes away? Your adrenals are always on guard, and they get tired. They can get into a adrenal stress situation or fatigue. So here's the symptoms: anxiety, depression, moodiness, headaches, you can read all those, irritability, forgetfulness, fatigue is huge. A lot of people have a lot of fatigue, low energy, bloating, diarrhea, vomiting. And again, the elevated blood pressure and heart rate, which can change with positions, and then even elevated blood sugars, glucose. So the treatment I like are herbs. There are some great adaptogenic herbs. And what adaptogenic means is it goes into your body and adapts to what you need. And so we do adrenal testing, and I'll talk about that later with the Dutch test or a saliva test. But I really like using adaptogenic herbs. And there is also some supplements that have bovine adrenal tissue in them. We're not as crazy about those, but I have used those in the past. So when you have bovine, which is a cow adrenal tissue, and you take it, it actually trains your adrenals how to work better. So that's all good too. We don't prescribe hydrocortisone very much or really much at all, but I know some doctors do, some functional medicine doctors do. And just so you know, the adrenals are like the building block for hormones. And we all know that hormones can cause some problems. DHEA is one of the things that your adrenal makes. And so I often check DHEA in my people who have hormonal issues. It's a fatty acid in the body that's a precursor to cortisol and testosterone. And so women and men both have testosterone, so I often like to check that. It could be elevated if you're in inflammation, and really DHEA needs to be supplemented if it's low, or actually working through the adrenals. So moving on, am I talking too fast, or are we all good?
This is good.
Good? All right.
Question?
Yes.
What adaptogen herbs do you specifically recommend?
My favorite is ashwagandha, and I like to say it too. Ashwagandha, a lot of people like maca, rhodiola, those type. But ashwagandha has worked beautifully with people. So endocrine, insulin, hemoglobin, insulin, is what your pancreas makes to help control glucose. Glucose is your blood sugar. Hemoglobin A1C is a great lab to do too, and we're gonna go over those quick. So insulin resistance, I'm sure people have heard about that, pre-diabetic type things. So I like to check insulin. I'm more specific with patients though. I mean, if they don't seem like, they're on that path or have a genetic factor, I don't necessarily do it, because this one needs to be fasting. So you take a fasting medication. You can do fasting and not fasting, but I like to do a fasting. If they're borderline elevated, that could be the pre-diabetic part. Improving your adrenal function helps with your insulin. So think about that. If you could stop yourself from going down the diabetes, path, just by helping your adrenals, that would be awesome. So it can normalize the insulin levels. A1C, when they taught us this in physician assistant school, I had to kind of chuckle because I had already worked, as a PT on the side, just, knew about diabetes. But A1C is great because it measures the percentage on your hemoglobin, a protein that carries oxygen and is coded. It's called glycated. But what's funny to me is A1C will measure your blood sugar in 3 months. And the reason I laugh is because I knew so many diabetic people that were really good the week before they had their sugars checked. Because they did what? They were like, I can beat the system. They're like, I could beat the system, not anymore. Because A1C is gonna measure a 3 months worth of what's happening in your blood. So the poorer your blood sugar control, the higher your risk of the diabetes. So it's measured every 3 months. And that's really the indicator that they use when they give insulin to keep track of that. Hormones. So I am a women's health physical therapist, and I also worked in urology for 3 years. So I saw a lot of women. And I actually started a pelvic pain program in a urology clinic. So I like talking about hormones, and I've seen hormones make huge changes with people. Now, the Women's Initiative did say that the best time to have hormones is your first 5 years of menopause, or as you're getting into menopause. But I have read also that if people have ongoing symptoms, so you can have menopausal symptoms for 10 years or more, yay. To help with some of those symptoms, hormones are not harmful to help keep those symptoms at bay. So estrogen, there's 3 main estrogens that we can test. Estradiol is the major one, and then progesterone, and then testosterone, and then also the sex hormone binding globulin. So that's a protein in your body that holds on to, mostly the testosterone, but holds on to the hormones so your body can't use it. And it brings it to the liver to get rid of it. Your liver does a lot of processing of hormones. So guess what? We also like to check liver function to make sure that your liver can handle getting rid of all those hormones. Treatment with estrogen, I again like to use herbs. The ones that I have, the maca adaptogenic herb has really been nice and recommended a lot lately. But we can do hormone replacement therapy as well. I like to use micronized progesterone because your body absorbs it better. And then, you know, the jury's still out, but usually people like to do more of the creams for estrogen. And they're easier to control, and I like that because you just control how much of the cream you use. But we can do capsules, tablets, creams, injections, patches, troches. Herbs, like I'm sure you've heard this, but black cohosh is also really good for estrogen, and wild yam for progesterone. But my favorite is evening primrose oil. It's actually an omega-6 fatty acid, and everybody needs more omegas, you know, whether it's 3s or 6s. But evening primrose oil helps with pain, helps even out your hormones, and helps you sleep. So it's a trifecta, so I like that one. Clary sage is nice too, and the other one a lot of practitioners use is chasteberry. Chasteberry is an herb that helps even out your hormones. So those are the things that I would talk to with somebody. Also the sex hormone binding globulin, like I talked about, just need to know if it's doing its job or if it's taking too much of that free hormones out of your system. So we already talked about estrogen, you know, deficiencies can cause night sweats, hot flashes, vaginal dryness, and so basically the vaginal dryness, urethral function. So a lot of women who had frequent UTIs, urinary tract infections, had vaginal dryness. And so we can do like an estrase cream, you know, to help, and that's, you know, putting it in the vagina, and then that can lubricate that and their UTIs went away. And I know the UTI is the urethra, but you know, they're neighbors. They're right by each other there. So it can also help you sleep, decrease the hot flashes, get rid of the brain fog, those type of things. But one of the things I did a lot with is progesterone. Progesterone is very safe, and you can use progesterone alone, even if you still have your uterus. You don't want to do that with estrogen. You want to balance them. But progesterone is the calm, happy one. And actually, it helps support memory and sleep. And I always tell people this too, that when you look at your cycle, you know, progesterone is kind of after, you know, you've had that PMS and then the progesterone kicks in. But progesterone also is the baby keeper. It's very important. So a lot of women that struggle with those type of things are low in progesterone. So again, this is just progesterone therapy can be protective for the endometrial cancers. It can help with irregular menstruation, helps with sleep, decreases anxiety, and people lose weight when they're on progesterone too. Males need a little bit of progesterone once in a while. We're going to get into testosterone next. So testosterone, I was really nervous at my last job when they said we were going to treat testosterone because I thought I'd get all these guys coming in and just wanting to bulk up, right? Because they heard that's what you can do. But it didn't happen. It was, I maybe had one. And it was actually men going, you know, there's something wrong. My libido is not good. My muscle mass is going down. They were gaining weight. They had the brain fog, bone, muscle energy, all the same stuff going on. And once we got them going on some testosterone, it just turned them around and they were so thankful. So what I would prefer to do is to stimulate a patient's own testosterone, and actually like strengthening exercise can make you have more testosterone. So I'm big into women and men both doing more strengthening exercises because there is side effects to testosterone. And that's something I'm really upfront with everybody about is it can cause male pattern balding, can cause anger and aggression, raising the hemoglobin in your blood so it thickens your blood. So all of my guys on testosterone, every month or every 6 weeks I check their hemoglobin because you don't want to have thick blood because that can cause some problems. And then it causes decreased fertility and testicular shrinkage. Because what happens when you give a guy testosterone, or a woman, because we make it too, is your body's like, oh good, I have testosterone, I don't need to make it anymore. Mm-hmm. So that happens with that, so that isn't necessarily my first choice. I have found more recently some really nice herb combinations, you know, saw pimento and some other things that can help you make testosterone. So testosterone, and testosterone, I always say too, so besides your body going, you don't need it anymore, it's a commitment. So if I did do testosterone, the cream needs to be applied daily, and the injections, if you go that route, are weekly, and they're forevermore. You know, you don't get off of it because your body gets used to having that. So that's the pros and cons. And we already went over this, you know, the flabby, weaker muscles when you don't have testosterone, loss of hair, indecisiveness. One thing on here kind of made me laugh though, maybe it's later, that having too much testosterone makes you bossy. I'm like, that's a tough one to diagnose or to quantitate. Okay, moving on to labs. I think we're doing okay time-wise. So these are some of the labs I do: complete blood count, comprehensive metabolic panel, ferritin is big for me, and also a lipid panel. So the complete blood count, if you aren't familiar, is we check your white blood, it checks your white blood cells and also the components of your red blood cells, but the thing I'm super interested in is your hemoglobin. Hemoglobin has to do with your iron level and tells me, and that could be contributing to fatigue. I see lots of people with fatigue. And I'm like, has anyone checked your hemoglobin level? And usually that might mean that they're anemic. And that's something that oftentimes just eating foods rich in iron can make a huge difference for people. We don't even need to supplement for it. Comprehensive metabolic panel. I'm sorry that that's kind of weird on the side over there. It's not on my screen. So comprehensive metabolic panel includes kidney and liver function. I love that. I want to know what your kidneys are doing, how your liver's handling all of it with your enzymes, what your electrolytes look like. So that's your, you know, calcium, magnesium, potassium, all of those things, and also your glucose level, so your sugar level. It's best if it's fasting for those 8 hours. And you may or may not know this, but you know, our bodies are all trying to get rid of toxins all the time. So you urinate to get them out, you have bowel movements to get them out, you sweat to get them out, and you breathe to get it out. So if one of those systems is not working, your other systems have to work harder. So I want to know if your liver is working harder because something else isn't, or your kidneys aren't functioning. So ferritin is an added test I often do to monitor your iron store. So how much iron you have stored, because the hemoglobin kind of tells me what your active iron is doing, but your ferritin tells me how much reserve you have. So a lot of people are like, well, I kind of peter out at the end of the day. So I want to know what your ferritin's doing. It's a body store of iron, and low levels can cause fatigue and increase inflammation. There are some supplements that I can use, like bioiron, but like I said, food choices are huge. And the medication is ferrous sulfate. I did work one place that we did do iron infusions because people's ferritin and their iron levels were so low. Now this is my other little trick with iron. It's better absorbed if you take vitamin C. So vitamin C, I often recommend like 2,000 milligrams when they're on iron. And it also helps not get constipation because iron can cause constipation. So I always insist that, or recommend, that people take vitamin C along with it because it does both of those things. And then somebody's like, well, can I just drink orange juice? I'm like, you're gonna have to drink a lot of orange juice. But you can, yes. Lipid panel, I'm sure everyone's familiar with these if they've not even had these done. So I look at total cholesterol, LDL, the low density lipids, and the high density ones. You know, I'm not a big statin person. We can put people on statins if we need to, but I like to start natural, and bergamot is my favorite herb to do that with. And I have seen people's lipids go way down, and these are the people that it's so exciting for because they have done everything to get their lipids down, but they have such a strong family history. So they're working against family history, and they really don't want to go on the statins. So bergamot's helpful, omega-3 is helpful. If people are on statins, here's another thing about our bodies is statins decrease our CoQ10, which is a major antioxidant. So if they choose to be on statins, which is fine, that's their choice, then I say, will you at least take 200 milligrams of CoQ10 every day because I don't want your antioxidant level to go down. And usually they're being to do that. And actually CoQ10 was one of the big recommendations with COVID, people having COVID too. So let's zip through these. Vitamin D, vitamin B12, selenium, iodine, magnesium. These will be fasted. We're wrapping up here. Vitamin D is one of my favorites. That's another one that's highly recommended. I love it when people come in and say, I don't need vitamin D. I'm outside, I'm a construction worker, whatever. I said, unfortunately, we live here. And one of my clinical instructors said, if you're not in the bright sunshine near the equator between 11 and 2 every day, you probably need vitamin D. And so, but we can test this. We can test this with some lab work. Again, my level is higher than what you would have in the clinic as expected. The clinic wants you to have 40 and I like you to have 80 because it's such a big component to hormones, bone health, overall healing, and it's one of the biggest things that is depleted in people. Also, mitochondria function, if you've heard of that. Mitochondria are kind of like the little cell batteries, and if you don't have healthy cells, you know, the rest of your body can't build on that either. Something that at my last job, we haven't implemented it here yet, is some people just don't absorb vitamin D. So I have them take K2. K2 helps them absorb it, but there also is an injectable D3 now too that we can do. So vitamin D is big. I usually check that in the labs. B12 also, that can improve your energy, mood, brain function, and nerve health. Excess vitamin B6 can cause numbness. And in my naturopath training, they were big on this, that you shouldn't take Bs alone. If you take a B12, you can deplete your B6. I had never heard that before. I took B6 for migraines personally for years. But what is great is that I often have people take a B complex, and then you can put another B on top of it. And what you don't use, you pee out because it's water soluble. The other little tidbit that I love too is B3 is big, and that's niacin. And niacin can actually help you stop smoking. So when I worked in the chronic pain clinic, there are some surgeons that wouldn't do surgery until people stopped smoking, and I put them on niacin, non-flushing, because there's a flushing one that makes you all bright red, but they were able to stop smoking. Because niacin attaches to your nicotine receptors in your brain, so you don't have the same urge to smoke. Kind of works with coffee a little bit too, but not as well as with nicotine. So selenium and iodine, you can use the thyroid support. And these are important to go over, and then we'll just go over some specifics. So additional testing. Back to the vitamin Bs though, this is something I learned from Dr. Regner, which I think is cool, is she has something called a vibratory test that you can check your vitamin B12 level with a tuning fork to see if your vibration, if I feel it longer than you do, it means you might be depleted in vitamin B12 because vitamin B12 helps with nerve conduction. So that, again, is a functional test that we do. So additional tests, we like these tests a lot. A lot of people that come see us have chronic illness, have seen a bunch of people, have chronic pain, those type of things. So we have other labs we use. The Dutch test is awesome for adrenals and hormones. It stands for dry urine test. And so you pay for it, and it's an extra cost, but they send you the kit, and then you do some urine samples in a 2-day period, send it in, and then they send you the results, and it's a 12-pager. So we find out about your DHEA, your adrenals, your micronutrients, your neurotransmitters, all of your hormones, and then it has all these pictorial things. It's awesome. The Great Plains testing tests toxins, mycotoxins, and other environmental toxins that you have might be clogging the system in your body, so you aren't functioning the way you'd like to. So that's a urine test as well. And then Genova. Genova has the adrenal saliva test, but it also has stool sample tests. So if we get stuck with your digestion and things like that and want to do a stool sample, so we have ideas. Another one that we just started to work with is called Vibrant, and they have really advanced lab testing, and one of the ones I'm really interested in is their Lyme and co-infections, because Lyme is so hard to test positive with, even though you have it. A few medications, I use low-dose naltrexone more in my last job because I did more orthopedics, but low-dose naltrexone helps with chronic pain. And it's a very, very small dose, and you may not know this, but naltrexone is what we use to get people off opioids. And so it's a very important medication to have to get people off opioids, but when you use a very, very small amount, It, again, works on the receptors in your brain and it decreases pain. A lot of people have had a lot of success with this. Some of the conditions, Crohn's, fibromyalgia, autoimmune conditions, multiple sclerosis, it does detoxify, and again, the opioid dependence helps with that. My only thing that's tough with LDN is it can take 4 to 6 months to really help. So people get frustrated. They're like, when's it gonna help? I'm like, hang in there. You know, but then when it does kick in, they really have a lot of good success. I am a CBD believer. When I was in Minnesota, I was a medical marijuana provider. I am not able to do that here, only physicians are, they tell me. So I do, that's a whole nother conversation, but I have worked in chronic pain and I do believe we need other ways. I'm almost done. Is that my signal? Okay. So just briefly, just so you know, anti-inflammatories, these are things on our list. Tissue repair, you can see all the vitamins, collagen, mast cell stabilizers, those are your histamine ones that we work with. PEA is one of my favorite, I use that instead of ibuprofen. And there's a big thing about PEA, cytokine suppressors. We obviously talk about diet, sleep, stress, exercise, and how that influences. And then we already talked about B, complex magnesium, helping with nerves. And there's some calming herbs, valerian root, kava kava. I like essential oils too. I use those with people. I also treat a lot of scars. There's a lot to be done with scars. There's a lot to be done with your neurotransmitters, which are GABA and serotonin instead of the antidepressants or along with the antidepressants. And then just some of these. The only reason I have these in here was to kind of prove or show how we treat things different. So gastrointestinal, irritable bowel, reflux, all of those are diet. All of those are working on the probiotics, working on the digestive enzymes, seeing if you have enough acid in your stomach. Liver, gallbladder, we gotta make sure that's functioning well. Fibromyalgia, I used to see a lot of that, lots of amino acids. And then the last one was we treat, autoimmune, but we also treat a lot of infections. So Epstein-Barr, mono, Lyme's disease and its co-infections, and then mold. Lots of mold. There's a lot of tie-in with Lyme's with parasites, mold, heavy metals. So you gotta look at the whole picture. Sorry that went fast at the end, but mostly if you're interested in some of that, it was mostly kind of more guidelines on how we treat differently than in the clinic. So, or in a more Western-based medical clinic. So once we find the root, then we can work to move towards optimal wellness. And this truly is our mission, to provide compassionate, personalized, root function medical care to patients suffering with chronic symptoms. We're passionate about teaching and empowering our patients to help nurture them toward improved health. So I guess I was more chatty than I thought I was gonna be because it took more time. But we have, I think, 10 minutes, so questions. Yes?
Where are you located, number one? Number two, is it insurance covered?
Right.
And number three, why isn't this with your medical doctors?
Well, that's a weighty one, the last one. But anyways, the first one is we are in Watertown across from Hy-Vee Pharmacy. Dr. Wagner and she remodeled a new clinic there. It's called Eastgate, and it's on my card. So, and you can call. We do not take insurance, and I'll tell you why. And so, if we did take insurance, our hour and a half that we would spend with you, insurance would pay us 8 minutes. And so we don't want insurance to dictate our treatment. And so an initial visit with us is $510. If you are Medicare, you can pay us, and then we submit a form, and then Medicare can reimburse. We don't make that promise. And other insurances you can submit, and we'll sign that we saw you. But we needed to do cash-based because, that's how we needed to do that. And the third question was, why doesn't anyone do it? Because they don't think it's cost-effective. Right? You can see more people when you see them in 8 minutes, and I'm not faulting that. That's how medical care works and survives. I just really enjoy spending the time with people, and I often tell people, and this is a total truth, that I get more done in that hour and a half than I did 4 treatments when I was in family practice. And that's okay. That was their model. You know what I mean? I want more for my patients. So, yes. Anything else? And so you can call. We have a regular email at info@refunctionwellness.com, and it's on our card. And you can send questions, or not send questions, but if you are wondering about the business, you can email there. We do have a free 15-minute consult. And so those forms are at our table. So just write your name down and your phone number and your email, and either Dr. Wagner or I will schedule out, not with you, we will in our schedule call you and say, is this a good time to talk? And then you get to tell us what your questions are in those 15 minutes, and it's free. And then you can decide if you want to come or not. And there's no pressure, it's just like answering your questions. Yeah, so, and maybe this will help too. I see people the first time, I see them back in a month, often see them 3 to 6 months on their own, and then it's as needed. Dr. Wagner is busier than I am. She's been doing this for 4 years, and she's very good. And so she usually sees people initially, and then 3 months out, and then on from there. The other thing that I think is really important is communication. And so we have a portal system. And so when I get people's labs back, I portal them so they don't have to make an appointment and say, this is what your lab said, this is what I recommend. If you have questions, let me know. We'll talk about it further at your next appointment. Does that make sense? So if you have questions, you can portal message me, and that doesn't cost anything, and then we have that communication. Yes?
With that initial visit and the lab work that you're gonna, either you have current or you order more, how much more does that usually run above the 510?
So if I did the 14 things, which is like probably the max, through Quest, they're usually 150 altogether. The Dutch test is 300 because it's so intensive. And then the Genova test for the stools, don't quote me on this one, I don't use it as much, is like 150, I think. I don't know what the saliva test is on that one.
But if you had, like, say, current lab, and maybe you order just a few additional,
Absolutely.
then it would probably be quite a bit less.
Absolutely. Yep.
Then you said the following visit, the 1 month following
Yep.
the initial. What type of costs are for the?
That's a 45-minute appointment, and it's $255. Dr. Wagner has done an awesome job setting up this clinic. I feel very blessed that I joined her a year ago. I actually came and approached her, and so she took me in, so that was nice. Because I already knew I liked functional medicine from doing it in Minneapolis, so. Any other questions? Sorry I got a little fast there at the end, but I think you got the gist. Well, thank you for your attentiveness. And I'm here. Dawn, our health coach, is at the table. And again, if you want the PowerPoint or more information, you can put your name and email there. Otherwise, maybe I will see you around here in Watertown.